Community nursing is very dynamic, it's fast-paced, it's highly complex, we're specialist generalists, everything that you would expect to see in the hospital, you would get in community. We are the key to all services, so patients that are requiring social care, we can sort the social care out, we refer on to social workers, we work together. Patients that are end of life, we are providing real compassionate care towards the end of life, and for them to stay at home is something that we feel very passionate about, and it's something that we pride ourselves on in district nursing. Is we are a jack of all trades, but we are definitely the master of palliative care and wound care and lots of others, but palliative care is something that is very specialist in our role that we do. You need to be a good networker as well, because you spend a lot of the time in between patients on the phone speaking to multiple services, and you're liaising with these services and putting other services in touch, so you're creating this network of people in order to benefit the patient. I had quite a lot of early childhood loss and with my father, and I spent a lot of time with my father in and out of hospital, but he had home dialysis, and I spent a lot of time with him actually preparing his area for dialysis, and it was something that I wanted to do and wanted to help, and the fact that he was at home, and obviously nurses, district nurses coming in and out, and I was in awe of what they were doing and how much my father relied on those nurses, and that stayed with me for a long time. And when I came to do my nurse training and then had that exposure to community nursing, that's when I realised that this is what I need to do and this is my path in life, and to follow this. Community nursing is key for the future of the NHS. We need more community nurses coming out and choosing community nursing. The role is very complex. You are the key to a lot of services. We have got a very high demand of patients that are coming into community. There's a massive emphasis on getting patients out of the hospital. So we're finding these patients obviously that are acutely unwell. We need to manage them, but we need the staff in order to do that and raise the profile of district nurses. I've always said that district nursing is a secret service. Nobody knows really what we do, and that's because we don't shout enough about it. And nurses have always been a little bit unsure of whether to go into community for this reason. So I'm a huge champion of community nursing, and I'm happy to shout about community nursing because I'm very proud to be one, and I absolutely couldn't think of anywhere else I'd like to nurse than community.